So a dead tooth is a dangerous thing to leave lying around in your mouth. One of the risks of having your fillings changed and rechanged is that the nerve inside the tooth can become irritated, swollen, inflamed, and then the consequence of that, there's very little you can do about that, is unfortunately over time, the inside material in the very center of your tooth will die off. And once it's dead, that empty space can become infected. It's not good to have an empty space in your body filled with dead material, biologic material. It festers, it creates gases, and it can cause more irritation, more fluids. And that is what is the contribution of the death of a tooth and the formation of what we know as a dental abscess. And the trouble is, it's within this hard-defined, very non-expanding space, the tooth. And this makes this expansion and all this liquid and the gases and the bacteria that are on the dead material, they create pressure, and it is this pressure that can make an abscess incredibly painful. And it will literally explode, almost like a volcano, out of the end of your tooth and into your bone. So a dead tooth is a dangerous thing to leave lying around in your mouth at the best of times. And worse yet, if it dies really slowly over a long, long period of time, it's no less dangerous. And you may well have heard of people who have had other health issues. It can cause, arthritic concerns. It can affect your whole body health. Dead teeth need to be dealt with. The question is, how do we deal with them? And today there's a lot of information on the internet, and particularly a documentary that was made a few years ago, that really bad root canals or the treatment of these dead teeth in a very bad light. And I'm here not because I'm an endodontist, although I did study endodontics at a graduate level while I was at the Eastman Dental Center in Rochester, New York, for learning under one of the most brilliant endodontists in the world. And what he did for me was make me realize the skill level necessary to really do a good root canal. I think after I took the graduate course, I did less root canals, probably tailing off at the end of my dental years in practice to hardly ever doing a root canal, because I was so aware of the skill level necessary for it to be good. I would far rather refer a patient to an endodontist, a specialist in this field who does nothing all day long except root canals. What a root canal is that the dentist specialized in this treatment is going to clean away all the dead material. He's going to sort things out. If there's infection, even if it bursts through into the bone, he is going to do the necessary things. It may involve a course of antibiotics. It may include some curettage, which is the cleaning of the bone. It may include all kinds of cleaning things. But you can clean the interior of a tooth and make it so that it is really clean. Now, you may hear this is not possible, and years ago it wasn't possible. At least it wasn't possible for most people to do the cleaning adequately well. And that is when you get these problems with root canals, where they blow up years later. It doesn't have to be that way. And if you have an expert endodontist cleaning your tooth, filling it with skill and expertise, then it should be possible to seal this empty space so completely that it never causes you a problem. The tooth, however, will be more porous because it doesn't have the blood flow and the liquid flow internally that it had before the materials died in the center of the tooth. And this is why after you've had a root canal, those teeth can become very brittle. What I would suggest is you then get a crown on the outside of the tooth, because once the tooth has lost all the liquids inside it, the blood and the liquids that are normally present inside a live tooth, then the tooth dries out and becomes brittle. So one of the best things you can do is then have a crown made over the outside of the tooth to keep it safe, to keep it connected, it's protected all around. And when you do that, then the dead tooth really becomes nothing different from it's there in your mouth, and it should last the rest of your life. So I would encourage you to think carefully. I know some people know I'll never have a root canal. They're not painful when they're done well. The pain is from the pressure, agonizing pressure from a tooth abscess. And you want to go to somebody who knows what they're doing, and they know how to do this for you painlessly. And when they do that, you can have a restoration made and enjoy that tooth then for the rest of your life, trouble-free.